informed about their health and how to take good care of themselves, specifically in line with nutrition and particular diagnosis issue they have, and then referral processes to be done. The community entry phase, the mapping phase, the midlining, the activities we had to do in the community. Stressful because some of the community were quite large, like 2 out of our 3 communities in those 2 years were very, very large and quite large number of people too. But the impact in the community would be from our MIE report. I think our health outreach were able to cover for Balogwanalomu we were able to reach 3,168 people for the health outreach. I remember for Abeya community, it was not that much. That was like 89 people. Yeah. So for Olufade community, it was quite much. So we had 4,672 people. So if you go through our reports to discuss or open or discuss further some of what we find as health challenges in the community for each of the community. So, and one of our success story for our intervention in the community, for each of the community, I remember for Balogmalanomo community, we had an environmental intervention to the schools available in the community, secondary schools, the government schools specifically, and then the mortgagee's house. Yeah, and it was fun working in that community because the mortgagee was also a medical doctor, a medical practitioner who had traveled out from the US to become the leader of the community. For Abeya community, it was a remote area in Moro local government. They don't have lights, they don't have water, they don't have anything. So our intervention to the community, major intervention, was a wash intervention. We dug well for them, make it an automatic well. This thing, you will see the picture before it was completed because we had to do our presentation for the end of that. And then in Olufode community, we had to make the PhD itself accessible to ambulance for the entrance. So we made a road, like a gutter entrance for the ambulance, and then our health outreach to the community. Yeah. So that was it. For the succession plan, the departments have a succession plan whereby when we are done, the next people coming at some group are distributed to those community for the changes to continue. Because even when we enter some of the communities, we were able to see some of what those who had been there before did. That's why those things inform what our own intervention will be. So that will be like a continuation for the work. Public health specifically can be divided into 2. There are so many means of division, but this 2 particular one, clinical and non-clinical. Most of our community interventions have always tried to touch both clinical and non-clinical. Our experiences on the field has helped most of us to determine which area our major interest will be. For some people, they've always loved the clinical, while some of us, like myself, have always loved